of breath.
And the shortness of breath was amazing because something as simple as brushing your teeth would be like doing 1,000 push-ups.
That's what living with heart failure feels like for James Arden. For the teacher and bodybuilder, the initial diagnosis came as quite a shock.
Even though you get many warnings and many signs that this is so, you still fall into being surprised when it happens that you can't do certain things.
Heart failure is the inability of the heart to supply enough blood to the rest of the body for its needs.
Dr. Jersey Chen from the Yale University School of Medicine and co-authors studied Medicare records of heart failure patients over the last decade, from 1998 to 2008. Researchers wanted to determine how heart failure hospitalizations had changed across states and among races and sexes.
Heart failure hospitalizations have decreased by nearly 30% over the past decade, and that represents a significant decrease.
The study appears in this week's JAMA, Journal of the American Medical Association.
And that indicates we're making some progress in either the number of people who are developing heart failure, its severity, or making some improvements in the efficiency of heart failure care.
Researchers say it also represents 200,000 fewer hospitalizations, and that means a cost savings for the Medicare system. However, there is one group not benefiting as much from the declining rates.
Black men, their hospitalization rate hasn't declined as fast as other race-sex groups, and that indicates an area where we can improve.
Researchers also say those dying from heart failure 1 year after being hospitalized changed very little over the same decade, remaining at almost 30%.
We've got a long way to go to prevent death for heart failure, but we may have influenced its severity or the number of patients who develop it in the past 10 years, and that's probably a success story that we can take from this study.
Give me a deep breath in and out.
James is writing his own success story. He is looking forward to training again and to continue running a foundation he started in Tanzania for the underserved.
Stay with the program. Don't give out and don't give in, I always say.
Catherine Dolf, the JAMA Report.
Some states are doing a lot better in terms of reducing their heart failure hospitalization rate. And some actually are doing worse than the national average, indicating that care or patterns of treatment for heart failure are uneven across the United States. We've probably saved over 200,000 heart failure hospitalizations from 1998 to 2008 because of such a decline in the heart failure hospitalization rate for these Medicare patients. And that represents improvement in care and efficiency for the American healthcare system.
I saw that god-awful scar after it, it was a sobering, real sobering thing for me.